So this assessment was the cranial nerves, motor strength, coordination, sensory, and mental health exam assessment. When looking back on the video for the cranial nerves, I think I did pretty well on them. I did forget a few things. For cranial nerve 7, I did forget to have the patient puff their cheeks out. I should have examined their facial movements a little bit more in depth. For cranial nerve 10, I forgot to ask the patient to turn their head from side to side. For the rest of them, though, the patient didn't have any deficits. The cranial nerves were all fine. No abnormalities noted within the patient. For the coordination, the patient was walking, and then he did the Romanberg test. I forgot to have the patient put his hands out in front of him when I was having him put his hands to the side, but then I did remember that they're supposed to be out in front, so I did correct that. His coordination was good, though. He didn't have any tremors or anything. I didn't know any deficits with the motor function, the strength, or the coordination either. For the sensory test, I did forget to do, I did the sensory of the face when I did the cranial nerves, but I forgot to assess other extremities. Like I should have done his hands, his arms, his legs, his feet with the sensory test as well, with the sharp and dull side. The mental health exam was good. The patient remembered the 3 words that I told him after a couple of minutes, and then the clock that he drew was good. There was no abnormalities with that either. So overall, the patient did well with this assessment. I didn't find anything wrong or abnormal with it at all.